Hello, so this is my reflection for the stroke sim that we did on Wednesday, April 9th. So I found this experience to be very valuable in strengthening my clinical skills and my professional skills as a nurse. Overall, I felt like this was one of the most realistic learning experiences that I've had so far in this program, and it left me feeling more prepared for the real world of nursing. So one of the biggest strengths that I noticed during the simulation was how well our team worked together. I felt like Reagan and myself worked really well, that we had a good communication strategy, and that we both kind of shared the spotlight a little bit. The fast pace and high pressure situation really brought out the importance of strong teamwork and good communication. And I think that we did a good job of supporting each other and staying focused on our patient. I especially felt like my communication skills were strengthened both with my peers and through using the SBAR to communicate important information. Practicing structured communication in a high pressure situation helped me realize that it's vital to stay calm, organized, and concise, especially when things are getting intense. Another area that I felt I grew personally was responding under pressure. Strokes are typically high pressure situations, and so this scenario naturally brought a lot of urgency, and it challenged me to think quickly on my feet while still being accurate and efficient. I was surprised at how much more confident I felt making clinical decisions and prioritizing interventions, even with the added stress of having a live actor in the simulation. Having someone play the role of the patient made everything feel really real, which pushed me to stay sharp and also helped me tap into that patient-centered mindset. Just kind of remembering that, simulation or not, it's really good to be able to practice that compassion and professionalism. So I really enjoyed that live actor aspect of the simulation. During my one-on-one feedback session afterward, I received some helpful insights that I'm planning on carrying forward. One piece of feedback was to step more confidently into the role of the primary nurse. So I was encouraged to take more control of the situation, especially when leading the team and coordinating care. I also learned and was told that before giving the SBAR report, you need to really make sure you have all of your data that you need. So just taking that extra second, even if you feel like you don't have a lot of time, you do, just taking that extra second to double check that you have all the necessary information before you call a physician or a provider. It's easy to get and feel really rushed, but taking that extra second to gather your thoughts and ensure that accuracy can make a big difference. And then reflecting on areas for growth, I definitely want to continue building my confidence in my knowledge and clinical skills. I'm realizing that even when I don't feel 100% confident, I definitely know more than I give myself credit for. I think we all know more than we give ourselves credit for. Part of growing into the role of a nurse is trusting the foundation that I'm building and being willing to step into a leadership role when in the correct situation. And I also want to feel and get more comfortable doing my assessments, just like really confident in my assessment skills, and moving through them in a timely way. And that's definitely something I'll be intentional about in my clinicals moving forward. One thing I really appreciated about this sim was how interactive and realistic it felt with the use of the live actor. And it really brought a new dimension that I hadn't experienced it in this program. And it reminded me that in real life, patients aren't mannequins, and they have expressions, emotions, they show discomfort, and that element helped me to practice not just technical skills, but also the human side of nursing, compassion, empathy, and how to remain calm and reassuring even when the situation can feel chaotic. So in conclusion, I feel like this stroke simulation was a really valuable step in preparing me for clinicals and for the real world of nursing. It really challenged me, but in a good way, and it has reinforced all of the skills and the knowledge that I've learned in my classes so far. I'm definitely walking away from this experience feeling empowered, prepared, more confident, and honestly, just even more excited to go out into the real world and practice my skills. So this opportunity really helped bridge our learning from the classroom with real life experience, and then getting that feedback was really valuable. So I can't wait to use all that I learned in the simulation moving forward. Thank you.